Welcome everyone to today's video, where we'll be showcasing the transformation journeys of multiple patients. So, let's begin with the journeys of our first patient and see how their hair transplant surgery transformed their appearance and boosted their confidence.
Is your city making your hair transplant more expensive? We will tell you how your city can affect the cost of your hair transplant and why our patient chose QHT Clinic after understanding this. With the help of our expert team and the QHT Technique, our patient transformed his look from bald to youthful. In today's case study, we are talking about a 31-year-old patient who was dealing with the baldness of Norwood grade 4A since the age of 24. His hair loss was genetic, and even after consulting other doctors and trying medications, the hair fall didn't stop. His hairline kept receding and the frontal and mid-scalp areas became visibly bald. After facing baldness at a young age for 4 to 5 years, he finally decided to go for a hair transplant. Why did he choose QHT Clinic for his transplant? He chose our QHT Clinic because he had seen consistent results on our social media platforms. From detailed case studies and genuine patient testimonials to powerful transformation videos. These videos showcase real journeys of patients from bald to young, covering every grade of baldness, all age groups and people from different cities. Whether it's someone from a metro city or a small town, patients from all across India and even abroad have trusted QHT. It's not just about celebrities or YouTubers. We have helped thousands of everyday people with natural looking results at affordable prices, making hair transplants accessible to the common man. When our patient came in for consultation, he had many questions and concerns. He even traveled from his city just to get proper clarity and his transplant. But after meeting our experienced doctors, all his doubts were resolved, and he got clear answers to every query. That's when he confidently decided to go ahead with the procedure. His hairline and temples had completely receded, and the frontal area was fully bald. Because of that, even the mid-scalp had started to lose hair gradually. This was the area where hair transplant was most needed. In the crown region, there was some thinning, but with the help of PRP sessions and proper medications, that can be improved. Thankfully, his donor area was quite dense, which really helped in making this hair transplant journey successful. The shape of a hairline is never random. It's carefully crafted based on the patient's facial structure, age, and forehead height. It usually begins from the glabella point, the center between both eyebrows, and then the curve, height, and even temples are designed in a way that naturally fits the face. In a hair transplant process, hairline and temple designing is the most crucial step because the entire implantation follows this layout. If this isn't done properly, the final result can look unnatural and affect the patient's confidence. That's why at QHT Clinic, our experts combine art, science, and rich experience to create a natural looking hairline and temples that match the patient's facial frame, baldness grade, and age. They have successfully designed over 10,000 plus such hairlines and continue designing 5 plus unique ones daily for multiple patients, each tailored to their specific needs. For this patient, our expert created a custom-shaped hairline that enhanced his facial features. After the hairline designing, by following the marking areas, they implanted single and thin hair follicles in the hairline zone to achieve a soft and natural look that enhanced the patient's facial features. For the frontal and mid-scalp regions, double and triple hair follicles were implanted to restore volume and density. In this case, a total of 5,000 grafts were successfully implanted. After the procedure, our follow-up teams contacted the patient twice a day to ask about his condition and provide advice on post-transplant care. We recommended protecting the scalp from dust and sunlight, also wearing a loose surgical cap and applying saline spray twice a day. 2 months following the transplant, when our patient visited the clinic for his first follow-up PRP session. During this visit, our experts noticed that approximately 90% of the transplanted hair had shed. This shedding is a normal part of the hair growth cycle and typically occurs within the first 3 to 4 months after the procedure. At the same time, the donor area had fully healed. If we compare the 6-month result with the first PRP session done in the 2nd month, our patient was in the shedding phase at that time, where most of the transplanted hairs had fallen out. But after 6 months, there is a visible transformation. His hairline and temples have taken a proper shape according to his facial frame and look very natural. Growth is clearly visible in the frontal and mid-scalp areas, and the transplanted hairs have merged well with the native ones. However, some thinning is still present, which is expected to improve gradually in the upcoming months with the help of regular PRP sessions and medications. Are hair transplants really worth it? Undoubtedly. Hair transplant is one of the most effective and permanent solution to restore lost hair, and you can clearly see that in our patient's results. If we compare his condition at the time of consultation to his 8-month result, there is huge difference. His hairline and temples were completely receded, but now they are perfectly framed and enhance his overall facial appearance. His frontal and mid-scalp areas were almost bald due to Norwood stage hair loss, but today they are filled with thick, strong and voluminous hair. The slight thinning in the remaining areas has also healed well with the help of PRP sessions and proper medications. Speaking of his overall look, it has completely transformed. Facing baldness at a young age doesn't just affect appearance. It also impacts social interactions like attending parties or meetings. But after this result, our patient not only regained his lost confidence, but is now fully comfortable with his appearance. The hairstyles and haircuts he once missed, he can now enjoy freely. We hope that after seeing this transformation, most of your doubts about hair transplants are clear, and you now understand that it is truly worth it, as long as you choose the right clinic, right location, and experts who stay consistent with the process. Investing in a hair transplant means investing in your looks and self-confidence. It's a way to regrow your hair using the most natural method, especially when you choose the QHT transplant technique. After a hair transplant, you will begin to grow a full head of hair once more. If you also want to transform your look from bald to bold, or want to take control of your hair loss, then book a consultation with our experts.
Now let's move on to the next patient and take a look at their hair transplant journeys.
What if your shed hair could grow back, and along with it your lost confidence too? Would that be just a physical transformation or something much deeper? In today's case study, we are introducing you to someone whose journey wasn't just about getting the hair back, it was about reclaiming his identity. When he first walked into our clinic, he said, "Hair loss didn't just take away my looks, it stole my self-esteem." But then something incredible happened. With each new strand of hair that grew, so did his confidence. And soon it wasn't just his hair that transformed, his entire personality did. This is his real story, his real transformation. From hair loss to hair boss. And this case study isn't just about results, it's an inspiration for anyone who faces those everyday comments, judgments and quiet insecurities. If you have any question about hair transplant or hair loss, drop them in the comments. We will answer them in our next video. Today in this video, we are sharing the impressive journey of our patient who faced the challenges of diffuse grade 3 vertex baldness. His hairline completely receded and changed into an M shape, which affected his frontal area. But in his mid-scalp area, some thinning was visible, which will be improved through medications and PRP sessions. There is no need to transplant. Along with the frontal, his crown region was also damaged. Thankfully, he had a dense donor area that was full of healthy follicles, which played a significant role in his transformation. After a thorough scalp examination, our experts started the hairline designing process. It began with a hair trim and a head wash session to prepare the patient for the procedure. After that, we carefully designed a custom hairline that perfectly matched the patient's facial features and bone structure, making sure it looked natural and truly suited him. We placed the hairline exactly 7.1 centimeters above the glabella, the spot right between the eyebrows, following the 4 fingers rule. It's a trusted aesthetic guideline that helps keep the hairline in perfect balance with the rest of the face, making the overall look natural and well proportioned. From the top view, the hairline creates a soft, rounded impression designed to seamlessly complement the patient's natural features, as it helps achieve a fuller and more natural looking outcome. In addition, to the hairline, the entire affected area was carefully outlined, guiding the implantation process and ensuring even graft distribution. This level of precision guarantees a result that is not only aesthetically pleasing but also balanced and harmonious with the patient's overall appearance. After all the making were completed, the procedure began with the injection of lignocaine 2%, a local anesthetic. This medicine blocks the nerve signals that carry pain to the brain, so the patient feels little to no discomfort during the procedure. It was carefully injected into both the recipient area, where the hair would be implanted, and the donor area, from where the hair would be extracted. Once the anesthesia took effect, our experienced team started the slit creation process in the recipient area. After creating the slits, the extraction and implantation phase began. To achieve a soft and natural hairline, we implanted single thin hair follicles in an irregular pattern, following the natural angle and direction of hair growth. This helps the new hair blend in perfectly with the surrounding hair. In the frontal area, we implanted double and triple hair follicles to achieve density and volume where more coverage and thickness were needed, as well as for the crown region where hair naturally grows in swirl pattern. We used a combination of single, double and triple follicles implanted at varying angles to mimic the natural swirl and give a natural look. In total, 3,500 grafts were transplanted, all extracted from the patient's safe donor areas. After the procedure, our doctors advised him of a simple and essential aftercare routine to help ensure the best possible results. There are a few important things to keep in mind after the implantation process. Avoid direct sunlight, dust and pollution. Whenever you step outside, make sure to wear a surgical cap. It helps protect the scalp during this sensitive time. Even if you feel itching, do not touch or scratch the transplanted areas. Also, eating a healthy diet and taking your prescribed medicines or using topical treatments on time will all support a smoother recovery. Yes, the first few days may require some patience, but trust the process. With the right care, you are giving your new hair the best chance to grow strong, healthy and naturally. At the 1 month mark after the transplant, the patient returned to the clinic for his first follow-up PRP session. It is an important step that plays a key role in boosting healing and supporting healthy hair regrowth. During the scalp examination, our experts noticed that around 60% of the transplanted follicles had shed, which is a normal part of the hair growth cycle. In this phase, the patient's hair roots settle down and the native hair starts growing even stronger. Many patients get anxious at this stage, but they should not worry at all, as this is a natural process that ultimately helps in achieving the best results. At the same time, the donor area had also completely healed with no visible signs of extraction. By the 4th month, visible progress had already begun to take shape. The patient's hairline started framing his face more naturally, enhancing his overall facial structure. Both the frontal and mid-scalp regions showed a beautiful boost in density, creating a more youthful and fuller appearance. While some thinning still remained in the crown area, it was well within expectations, a phase that typically improves in the coming months as new growth continues. What was especially encouraging was that both the donor area has healed completely, indicating a healthy and smooth recovery process. At this stage, the foundation was set and the most exciting changes were just around the corner. 6 months post-transplant, the transformation was truly remarkable when compared to his initial condition and even the 4-month milestone. The difference was clearly visible. His hairline, which had once completely receded, began to reappear around the 4th month, but by the 6th month, it had become well-defined and perfectly framed his face, enhancing his overall features. This comparison between the before state, the early progress at 4 months and the 6-month results clearly reflects the powerful impact of consistent PRP sessions and prescribed medications. In the frontal and mid-scalp regions, where significant thinning was once evident, early signs of growth had emerged by month 4, but the density was still limited. By the 6th month, those same areas showed strong, healthy regrowth with a noticeable improvement in volume. The crown, which had been sparse and damaged, also began forming a natural swirl pattern, closely resembling the original whorl, now more defined and aesthetically pleasing. This progress resulted in a balanced, fuller look and, more importantly, a renewed sense of confidence. His transformation was visible not just in the mirror but in his smile and the way he now embraced new haircuts with ease. And yet, this wasn't the final outcome. His hair was still maturing, with even better results to unfold in the months to come. It's important to remember that early results can vary from patient to patient, depending on key factors like age, genetics, and how consistently medications and PRP sessions are followed. What we have shared today are just the outstanding results at the 6-month mark, and the journey is still ongoing. We will continue to keep you updated with the upcoming progress, so stay connected to witness the full transformation unfold. This is the journey of our patient who went from diffuse grade 3 vertex baldness to a fuller, natural looking hairline, improved frontal and crown area. If you are looking to transform your look from bald to young and energetic, book an appointment with our expert team. Thank you for watching.
Now let's move on to the next patient and take a look at their hair transplant journeys.
Hello viewers. Today we are excited to share the 12 months transformation journey of one of our patients who was facing the challenges of Norwood grade 2 baldness. This is a repair case as he had previously undergone a hair transplant at another clinic but didn't achieve the desired results. That's why he came to us. As you can see from his pictures, his hairline receded along with temples and noticeable thinning visible in the frontal area, but his rest of the scalp is healthy. Also, he had a dense donor area which plays an important role in the transplantation. This repair case presents a unique challenge because unlike a fresh hair transplant, we don't have the full potential of the donor area. Stay tuned for the result. After examining the scalp, our surgeons designed a custom-shaped hairline that perfectly matched the patient's facial features. The hairline was positioned slightly lower in the middle, maintaining a precise distance of 7 cm from the glabella point. To frame the face, the temples were also shaped with great attention to detail and also marked the remaining affected area. During the procedure, our experts carefully placed single thin hair follicles in the hairline and temples zone to achieve a natural look. In the frontal area, double and triple hair follicles were used to create a fuller and denser look. A total of 2,300 grafts were implanted, all taken from the patient's safe donor area. 1 month after his hair transplant, our patient came for his follow-up PRP session. At this stage, we observed about 70% shedding on the transplanted region. This shedding occurred after an initial growth phase, indicating that the follicles are settling in and beginning their natural growth cycle. At the same time, his donor area completely healed. 4 months after his surgery, our patient's hair growth showed significant progress, a result of his dedication to following the prescribed medications and maintaining a healthy diet. This stage was important as it reflected both the success of the procedure and his commitment to post-operative care. The visible improvement in hair growth was a clear indication of progress, and as time passed, we anticipated further density, which would enhance the natural fuller look of his hair. This transformation was a testament to the effectiveness of our holistic approach to hair restoration at QHT Clinic. 9 months after his hair transplant, the hairline had beautifully framed the temples and the frontal area showed visible volume and density. At this stage, our patient demonstrated impressive progress. It was clear by then that the treatment had been successful, reflecting the high standards we upheld at QHT Clinic in delivering excellent hair restoration results. However, these were not the final results, as the full outcome was yet to be seen. 12 months after his hair transplant, our patient achieved remarkable results, showcasing the success of his treatment. Once struggling with severe baldness, he now enjoyed the freedom to style his hair and had recently chosen a new haircut. His hair looked so natural and flawless that it was virtually impossible to tell he had ever undergone a transplant. This transformation from noticeable baldness to a full, natural-looking head of hair was a testament to the skill and effectiveness of the QHT technique. The patient's journey served as a powerful example of how advanced hair restoration could dramatically enhance both appearance and self-confidence. This is the journey of our patient who went from Norwood grade 2 baldness to a fuller, natural-looking hairline and improved frontal area. If you are looking to transform your look from bald to young and energetic, book an appointment with our expert team.
Hello friends, if you have not subscribed to our channel yet, please like this video, share and subscribe to our channel, and don't forget to hit the bell icon so that you will get update on every video.